I want to tell you about a patient of mine. Her name is Ruth. Ruth is 73 years old, retired school teacher, careful woman, patient woman, the kind of person who read every label, followed every instruction, and kept a handwritten log of her fasting blood sugar every single morning for 4 years. Ruth has type 2 diabetes, diagnosed at 68, and she managed it carefully. Her medication was consistent, her diet was disciplined, she walked every afternoon, and yet, every morning, without fail, her fasting blood sugar was between 128 and 142, higher than her doctor wanted, higher than she wanted, and she could not understand why. She was doing everything right. She came to see me about a year ago, and she brought her log with her. 4 years of morning blood sugar readings written by hand in a small notebook, column by column, date by date. I looked at the numbers, and then I looked at Ruth, and I said, "Tell me about your evenings. What do you do before bed? What do you eat? What do you drink?" She told me, and then she mentioned something, almost as an aside, that she had read about 6 months earlier and had started doing quietly without telling her doctor because she was not sure it was real. She said, "I started adding a tablespoon of apple cider vinegar to a glass of water before my biggest meal of the day. I have been doing it for about 6 months." I looked at her log again. 6 months back, the numbers had dropped. 128 to 142 before, 109 to 118 after. Not dramatically, but measurably, consistently, every morning for 6 months. I asked Ruth, "Did you change anything else 6 months ago?" She thought carefully. "No, same diet, same medication, same walk, just the vinegar." My name is Dr. Daniel Chen. I am a physician in internal medicine, and today I want to explain what was happening in Ruth's body, what apple cider vinegar actually does to blood sugar, what the clinical research actually shows, and what the honest limitations of that research are. Because Ruth deserved a proper explanation of something that had been working for her for 6 months, without anyone ever explaining why. Let us begin. Now, first, I want to explain what apple cider vinegar actually is, because most people know the name, but few people understand what is in it. Apple cider vinegar is made through a 2-step fermentation process. First, apples are crushed and yeast is added to convert the apple sugars into alcohol. This produces apple cider. In the second step, bacteria convert the alcohol into acetic acid through a process called acidification. The result is apple cider vinegar, a liquid that is typically between 5 and 7% acetic acid. And it is the acetic acid that is the active component that researchers have been studying for its effects on blood sugar. Now, why would acetic acid affect blood sugar? The mechanism, or rather the mechanisms, because there appear to be several, are genuinely interesting and worth understanding. The first mechanism is slowed gastric emptying. When you drink apple cider vinegar before a meal, the acetic acid slows the rate at which food leaves the stomach and enters the small intestine, where glucose absorption happens. This is called delayed gastric emptying, and it flattens the blood sugar curve. Instead of glucose rushing into the bloodstream rapidly after a meal, it enters more slowly, more gradually, giving insulin more time to respond, and preventing the sharp post-meal spike that is so damaging to blood vessels over time. It is believed that acetic acid may interfere with disaccharidases in the small intestine, thereby slowing glucose entry into blood and gastric emptying. The second mechanism is inhibition of digestive enzymes. Acetic acid appears to interfere with enzymes called disaccharidases that break down complex carbohydrates into simple sugars. in the small intestine. When these enzymes are slowed, the breakdown of carbohydrates is delayed. And again, glucose enters the bloodstream more slowly. The third mechanism is increased glucose uptake by muscle. Research suggests that acetic acid may enhance the uptake of glucose by skeletal muscle cells independently of insulin through activation of a metabolic pathway called AMPK, the same pathway activated by metformin, the most commonly prescribed diabetes medication. This is a particularly interesting finding because it suggests that apple cider vinegar may work through a mechanism that partially overlaps with one of the primary mechanisms of metformin. The fourth mechanism, which explains what Ruth found specifically, is an effect on overnight blood sugar. A small clinical trial published in Diabetes Care, the flagship journal of the American Diabetes Association,
found something that surprised the researchers. Participants with type 2 diabetes followed a standardized meal plan for 2 days, with and without taking 2 tablespoons of apple cider vinegar added at bedtime. The results of the study demonstrated morning fasting blood sugars were significantly lower when participants took the bedtime vinegar. The authors noted the basic science research supporting an additional mechanism of vinegar to increase glucose storage in the liver and to increase the metabolism of fats. Now, this is directly relevant to what Ruth experienced. She took her vinegar before her main meal, which was in the evening, not specifically at bedtime, but in the hours before sleep. And it was her morning fasting blood sugar that dropped, the most consistent and reliable improvement in her 4-year log. This makes biological sense. The liver, during the overnight hours, releases stored glucose into the blood. The dawn phenomenon I have described in other videos. And if apple cider vinegar increases glucose storage in the liver, as the research suggests, less glucose is available for that overnight release. And morning fasting blood sugar is lower. Now, what does the broader clinical evidence show? I want to be specific because the research is real, but it is also limited in important ways. And you deserve the honest picture. A randomized controlled clinical trial of 70 participants with type 2 diabetes and hyperlipidemia found that 20 milliliters of apple vinegar per day for 8 weeks significantly improved fasting blood sugar with a mean change of negative 10.16 milligrams per deciliter compared to the control group. A 10-point drop in fasting blood sugar from the tablespoon of vinegar per day for 8 weeks. That is a meaningful number, not a dramatic pharmaceutical effect, but for a dietary addition that cost almost nothing and carries minimal risk at appropriate doses. It is clinically relevant. A systematic review and meta-analysis of all clinical trials evaluating the effect of vinegar on diabetes patients found a small but significant reduction in mean HbA1c of negative 0.39% after 8 to 12 weeks of vinegar administration. A 0.39% reduction in HbA1c. This is modest. To put it in perspective, metformin typically reduces HbA1c by 1 to 2%. So, apple cider vinegar is not replacing medication, not even close. But as an addition to medication and lifestyle management, a 0.39% improvement in HbA1c is a real and documented effect, consistent across multiple trials. A 2023 randomized controlled trial published in Frontiers in Clinical Diabetes and Healthcare treated patients with type 2 diabetes with 30 milliliters of apple cider vinegar per day for 8 weeks. Fasting blood glucose decreased significantly in the ACV group, and there was a significant difference in HbA1c levels between the two groups after 8 weeks. LDL cholesterol was also decreased in the ACV group. Now,
I want to be very honest about the limitations of this research because they matter. Most of the trials on apple cider vinegar and blood sugar have been small, ranging from 20 to 70 participants. That is not large enough to draw definitive conclusions. Most have been conducted over 8 to 12 weeks. We do not have long-term data on what happens over years. The quality of some trials in terms of blinding and control is not as rigorous as the gold standard. And there is variability between studies in terms of the type of vinegar used, the dose, the timing, and the population studied. This means that apple cider vinegar is a promising dietary addition with a plausible mechanism and consistent but modest clinical evidence, not a proven treatment, not a replacement for medication or lifestyle management, and not something I recommend instead of seeing your doctor, but as an addition. For someone already managing their blood sugar carefully, the evidence is real enough to take seriously. Now, let me tell you the practical details that matter, because how you use it and how you prepare it makes a difference. The first thing, the dose used in most clinical trials is between 15 and 30 milliliters per day. That is 1 to 2 tablespoons. 1 tablespoon is the standard starting point and what I recommended to Ruth to continue. More is not better, and higher doses carry more risk, which I will explain. The second thing, always dilute it in at least a full glass of water, 250 milliliters or more. Apple cider vinegar is acidic, a pH of approximately 3 if taken undiluted, or in small amounts of liquid, it can damage tooth enamel and irritate the esophagus. Dilution is not optional, it is necessary. The third thing, the timing matters. The evidence is strongest for taking it before a meal or with a meal, particularly the largest carbohydrate meal of the day for many seniors, that is dinner. The Diabetes Care study that found the fasting blood sugar effect used bedtime vinegar, not morning. This is the opposite of what many people intuitively expect, but it reflects the mechanism, the liver glucose storage effect, that operates overnight. Ruth took hers before dinner, which was her largest meal, and saw her morning numbers improve. That is consistent with the research. The fourth thing, rinse your mouth with plain water after drinking diluted apple cider vinegar. Do not brush your teeth immediately after, because the enamel is temporarily softened by the acid. Brushing immediately can remove enamel. Wait at least 30 minutes before brushing, or rinse with water and brush beforehand. This is a simple precaution that most people using apple cider vinegar are never told. The fifth thing, there are important situations where apple cider vinegar should be used with caution, or discuss with a doctor first. If you are on insulin or on medications called sulfonylureas, such as glipizide or glyburide, apple cider vinegar can enhance the blood sugar lowering effect, and in combination may cause blood sugar to drop too low. This is not common, but it is possible, and your doctor should know. If you are on these medications and you have kidney disease, high acid load from regular vinegar consumption may need monitoring. And if you have gastroparesis, a condition where the stomach empties too slowly, already adding something that further slows gastric emptying may worsen symptoms. Discuss this with your doctor. For most seniors with well-managed type 2 diabetes who are not on insulin or sulfonylureas, 1 tablespoon of apple cider vinegar diluted in a full glass of water before the main meal is a safe and evidence-supported dietary addition that complements other management strategies. But please, tell your doctor, do not add it quietly, the way Ruth initially did. Your doctor should know, because it can affect medication dosing, and because your blood sugar readings may change, and your medication may need adjustment. Now, I want to tell you what else Ruth did that contributed to her overall blood sugar improvement, because apple cider vinegar was one piece, not the whole picture. And I want to give you the complete picture that Ruth gave me. The first thing, she had been walking every afternoon for 30 minutes every single day without fail for 4 years. I have discussed the evidence for walking after meals in other videos, and it is among the most consistently supported interventions for post-meal blood sugar management in older adults. Ruth walked about 45 minutes after dinner, which meant she was walking during the period of peak post-meal glucose elevation. When muscle glucose uptake, driven by contraction, without requiring insulin, was most effective at pulling glucose out of the blood. The second thing, Ruth ate her protein and vegetables first at every meal, before her carbohydrates. The research on meal sequencing, eating vegetables and protein before starchy foods, shows consistent reductions in post-meal blood sugar peaks of 20 to 40% compared to eating carbohydrates first. This is because protein and fiber slow gastric emptying and reduce the rate of glucose absorption in the same way the apple cider vinegar does. They work through overlapping mechanisms, and they compound each other. The third thing, Ruth had completely eliminated sugary drinks, including fruit juice, from her diet 4 years ago, and she had reduced her refined carbohydrate intake significantly, as I described in Harold's story in another video. Refined carbohydrates, white bread, white rice, crackers are the primary drivers of post-meal glucose spikes. Reducing them and replacing them with whole grain alternatives and legumes change the character of Ruth's glucose response at every meal. These three things, walking, meal sequencing, and refined carbohydrate reduction, together with the apple cider vinegar, produce the consistent improvement in Ruth's morning numbers. Over 6 months, not any single intervention alone, but the combination working through overlapping mechanisms. Now, I want to close with what I said to Ruth at the end of that appointment. She had come in a little embarrassed that she had been doing something without telling her doctor. She was not sure if it was real or if she was imagining the improvement. She wanted me to tell her it was either completely proven or complete nonsense. I told her neither. I said, Ruth, the research on apple cider vinegar for blood sugar is real. It is modest. It is not dramatic. It will not replace your medication. But your log shows a consistent improvement that started when you started the vinegar. That is meaningful. And the mechanism is biologically plausible and well studied. What I want you to do is this: keep doing it. Tell your doctor so they can monitor whether your medication needs adjusting. Continue the walking, the meal sequencing, the reduced refined carbohydrates, because those things matter too. And come back in 3 months with your log so we can look at the numbers together. She nodded, and then she smiled, and she said, I just wanted someone to tell me it was real. That is why I'm telling you today. Because if you've been doing something quietly that seems to be helping your blood sugar, you deserve a proper explanation of what it is doing and why. And you deserve a doctor who takes your log seriously and explains the numbers, not just circles them. 1 tablespoon in a full glass of water before your main meal. That is what Ruth does every single day. And her morning fasting blood sugar, after 4 years of being between 128 and 142, sits between 109 and 118 consistently. I am Dr. Daniel Chen. Thank you for spending this time with me today. If Ruth's story resonated with you, please share this video with someone you care about who is managing their blood sugar after 60 and who might benefit from one simple addition to their evening routine. Leave your questions in the comments. I read every one, and I will see you in the next video. Take care of yourself and take care of your blood sugar every single day, because every single day is a chance to manage it better than you did yesterday.